A bill that would impact insurance for half of North Carolina's population is now headed to the House. First brought you this story just last night. The state Senate voting to limit how much health insurance companies can be required to cover. WCNC Charlotte's Julie Kay spoke with people both in support of the bill and against it. Julie, what exactly did they say about those impacted?
Well, it's a lot of people impacted for sure. We're talking directly to people who have government-backed insurance plans, including the 750,000 people on the state health plan. Now, this could also impact people who get insurance individually or through a smaller group plan, but strong opinions on both sides because North Carolina is the most expensive in the nation for health care costs.
To cover or not to cover? That's the question the North Carolina Senate hopes to answer with a bill that would stop adding requirements to health care coverage.
The amendment will be engrossed and sent to the House.
Senate Bill 24 now on its way to the House, hoping to lower costs. Right now, North Carolina requires insurance to cover 58 types of medical services, like emergency room visits or even tests for newborns. But if the bill becomes law, new procedures could only be added if an existing one is removed. So that leaves the question, what will go first?
You're now starting to pit people against each other of what is considered worth saving and what is not.
Calla Hales is the executive director of a preferred women's health center, one of the 14 abortion clinics in the state. While abortion isn't typically covered by insurance, she worries a bill like this could be a slippery slope in a state where reproductive health already feels fragile.
It's kind of all part and parcel of reproductive health care as a whole. So there is a very real possibility that it could impact things like preventative care, birth control.
But the cost of health insurance as it stands, too much to bear for small businesses.
Trying to find affordable health care is almost impossible.
Greg Thompson with the National Federation of Independent Businesses says that those high costs trickle down to everyone.
They either have to absorb, they have to pass it on to the consumer, or they don't carry it.
So while we wait for a verdict from the House, the question now is what to cover and what is to get left behind.
Now, most people who get insurance through a large employer won't be impacted. Those are typically self-funded plans, and that often includes companies like Wells Fargo, Lowe's, and even some hospital systems, Colin.
So the big question here, Julie, is why is healthcare so expensive in North Carolina as opposed to other states?
Yeah, that's really the big debate here. A number of mandates are a part of it, but that's not really the whole picture. Healthcare providers have pointed to the unusual percentage of short-term customers in North Carolina or people who drop insurance after they've been treated. It's also a big area with only a few major hospital systems, so it's definitely a combination of things, Colin.
Makes sense. All right, thanks for highlighting that. We appreciate that.